Good morning, everyone. Members of the faculty, distinguished guests, family members, and friends. Thank you, Dean Galea, for that warm welcome and for the honor of addressing you, the 2022 graduating class of the Boston University School of Public Health. And congratulations. As Commissioner of Public Health for the City of Boston, I'm particularly thrilled to have this opportunity to speak to you this morning because this institution has played such a vital role as a pipeline for public health leadership in the City of Boston. From bureau directors to deputy directors to chiefs of staff to program managers at the Boston Public Health Commission, many, if not most, have sat exactly where you're sitting and have been trained just as you have to strive to achieve health equity, to promote the health and well-being of the most vulnerable amongst us, and to not only declare racism a public health crisis, but to actually do something about it. They do the fundamental work that's the core of public health, and they do so passionately. And I would not be surprised at all if a future commissioner of public health for the City of Boston is sitting right here today. If that comes to pass, I'm confident in the knowledge that the public health in Boston will be not only in good hands, but in great hands. So I was appointed Commissioner of Public Health in July of 2021, and frankly, I love my job. I love working with people who are passionate and dedicated to public service. And I'm honored to serve the City of Boston, and I'm happy that my career journey has led me to this role. Everyone's career should be a journey. That journey can be direct for few people, go straight from A to B, but more than likely, it will be circuitous. You will detour. It really doesn't matter. Either way, you will have what I call defining moments. These are times in life when you will encounter someone or experience something that clarifies your purpose, that makes your path crystal clear, and helps you find a direction if you don't have one. Growing up, I didn't have a career direction. I didn't think that I could or would become a medical doctor. And I certainly didn't think I would end up in public health. Don't get me wrong, I did well in school. I had good parents, and I wanted to have a service-oriented career. But I really didn't think that I was going to excel in the sciences in college. In retrospect, I felt unprepared, and I was afraid to fail. The public high school that I attended wasn't well funded. There were no AP classes. Most students who did graduate didn't go on to four-year college. Luckily, I did, and I recall sharing the classes that I planned to take during my first semester of college with my father. To say that he was disappointed is an understatement. You see, my father was a Nigerian immigrant who really struggled in his own career path. He drove a taxi cab, he worked for UPS, he cleaned laboratories and hospitals. But he prioritized education, so he took classes at night, he studied hard, and finally, he became a successful podiatrist. So when I shared my class schedule, which lacked both math and science, he told me, stop underestimating yourself. Stop being afraid. Stop squandering your opportunities and your talent. He saw something in me. He saw potential that I couldn't see for myself. That was a defining moment. I became pre-med, I did well, and I thrived on the challenge. Fast forward to my fourth year of medical school at Johns Hopkins. I was rotating on the AIDS ward, where most of the patients were Black and poor, and they were dying, even though life-saving antiretroviral therapy was available. It was really hard to witness suffering driven by homophobia, stigma, poverty, and racism. That was a defining moment. The experience led me to dedicate my early career to addressing racial and ethnic disparities in HIV prevention, care, and treatment. Let's fast forward again to 2002, Just as the president's emergency plan for AIDS relief was rolling out, I was getting my master's degree in public health, I'm dating myself, like many of you, and I attended a lecture on the rampant HIV denialism and the destructive campaign of misinformation and disinformation that was inhibiting the rollout of HIV treatment in South Africa and leading to devastating loss of life. That lecture, that was another defining moment. After graduation, I found a job as a clinician educator in South Africa. I packed up. I moved to Durban to train clinicians and help build infrastructure at one of the first HIV treatment clinics in the country. Each of these defining moments has been meaningful and transformative. But being Commissioner of Public Health at this moment in time in Boston is by far the most challenging and yet the most gratifying, defining moment in my career. The reason that it's most challenging is obvious. Irrespective of what has been stated, despite the fact that we seem to collectively want to return to normal, we are still in the midst of a global pandemic. As Dean Galea has already said, more than 7 million people have died worldwide, 1 million here in the US. Black, Latinx, and Indigenous people continue to have a death rate that is nearly twice as high as white individuals. And more than 2 years in, our resources, our capacity, and our bandwidth are stretched thin. We are all tired. It's also challenging because historically, we as a country and as a world have undervalued and underinvested in public health. Throughout the pandemic, cracks in the foundation of public health infrastructure have been glaringly evident and inhibited our ability to stand up testing sites, deliver vaccination, and even communicate in a clear, timely, and trustworthy fashion. And though public health leadership has finally been vaulted into the spotlight, with many of our colleagues serving as experts on CNN, MSNBC, Meet the Press, Face the Nation, so on, so forth, the daily efforts undertaken by the public health workforce, the street outreach worker who reverses overdoses, the case manager who provides housing referrals, the inspector who ensures that our children don't suffer brain damage from lead poisoning, aren't being celebrated. In fact, those folks, they are underappreciated and they're woefully underpaid. Not surprisingly, attrition from the public health workforce has been high. At the Boston Public Health Commission, it saddens me to say that 4% of positions were open in 2018. Today, that percentage has nearly tripled. So if there are so many challenges, why do we continue to do this work? Why is it so gratifying? So I, like many of you, have a deep and unwavering passion for equity. I grew up on the south side of Chicago, one of the most racially segregated cities in the United States. And I vividly recall driving through the black part of the city in the 80s and 90s and seeing dilapidated buildings, boarded up windows, liquor store after liquor store after liquor store. But towards the end of that same street, all of a sudden, the sidewalks were clear, there were large, clean parks, a beautiful built environment, and all of the people were white. An invisible line divided that city and still does today. In 2019, in the neighborhood where my mom grew up in Chicago, Inglewood, life expectancy was 60, and on the other side of the invisible line, it was 90. Similar inequity has been noted right here in Boston just a few years ago, just over 3 miles away from where we sit. Let's turn to my father's homeland, Lagos, Nigeria. My family members who still live there don't have access to primary care. They don't receive much by the way of preventive health care, and most haven't been vaccinated against COVID-19. Guess what life expectancy was in Nigeria in 2019? 55. Not so far off from the 60 in Chicago. Local inequity and global inequity aren't so different. They're both grossly unfair. But if not for the public health achievements that we take for granted, clean water, safer and healthier foods, tobacco control, traffic injury prevention, and childhood immunization, the inequity would be much, much worse. And if not for the public health workforce, locally, here in the US, here in Boston, who are the safety net for vulnerable populations, things would also be much worse. They are spearheading this city's response to addiction. They ran one of the first mass vaccination sites in the city at the height of the pandemic, and they're completely transforming what our homeless shelters look like. This is us. This is public health. We tackle the toughest challenges, we lead, we create change, and that is what's so gratifying about the work that we do. COVID-19 has led to a number of long overdue reckonings with structural racism, with inequity, with mistrust, and with our fragile public health system. There has been a shift. We all feel it. And I believe that that shift could lead us towards a new day in public health. So how can we, as public health leaders, shape what that new day looks like? Well, we can be visionary. Just because something is the way it has been doesn't mean that it is the way it always has to be. The concept of innovation does not solely belong to Elon Musk and Jeffrey Bezos. We can reimagine public health. We can be innovative. Here in Boston, we sit at the epicenter of science, research, and technology. We can harness those resources, and we can be innovators. We can be brave. And when I say brave, I'm not talking about Twitter brave. I'm not talking about speaking truth and dropping the mic in 280 characters. Lots of people do that. They do it all day long. That's fine. What I am asking is that you be brave in words and in actions. We can take leadership roles that challenge us. We can make the tough decisions that will protect the most vulnerable, even if those decisions are unpopular. We can also invest in people. So I know I've used the term public health infrastructure probably 4 or 5 times in the last 10 minutes. Let me be clear about what that is. Number one, it is data and IT and surveillance systems. That's important. Number two, it's the agencies that respond to the public health needs. But number three is the most important. It is the people. It is us. We need to recruit, retain, and mentor good people. We need to compensate them well. We need to incentivize them to stay in their roles in public health. Because without good people, we will always have weak public health infrastructure. Lastly, we can build and we can sustain. Many people have talked about the boom and bust cycle in regards to public health. Do you know what that is? It's when everybody rallies for an acute emergency. That's the boom. Everybody rises to the occasion and the funding flows in, appropriately so, to manage the acute emergency. But when the acute emergency goes away, the momentum, the interest, the energy, and the funding disappear. Raise your hand if you remember what Zika is. Okay, so put your hands down. This is a completely biased sample. If you leave here and you walk down Comm Ave and said Zika and asked anybody what it was, the response would be Zika who, Zika what? The point is that we as a society have a short attention span. Right now, public health is front and center, and we must keep it there, beyond the typical news cycle. We need to build, we need to sustain, and dear Congress, if anybody is listening, we need to have long-term investment in public health. These are both challenging and gratifying times. You are here today because you've done something extraordinary. You completed your degree during a period of unprecedented uncertainty and crisis. Your resilience speaks to your ability to overcome any challenge placed in your way. This is an incredibly important time for you. This is more than a milestone. This is your defining moment. Embrace it, dive into it head first, be visionary, be bold, be brave, and help chart a course towards a new day in public health. Best of luck and congratulations.